Teneko tukatua, tuaroki na mate hare hare atura. Kia tato e do ne kiora. Ko Hudson River, te awa ke te noho oki Wellington Aotearoa. Ko Stephen Croucher, aho. Morena, good morning or good evening, good afternoon, good morrow. Hello, everyone. I'm Stephen Croucher, the head of School of Communication, Journalism, and Marketing at Massey University. And I'm coming to you live and in person from Massey University on our Palmerston North campus for the ICA Regional Hub here in Aotearoa, New Zealand. And I'm really happy that we can be here in person. So if I could have Richard just pan out. So sorry, folks, we have to be on camera for a second. Everyone look good. It's been great the past few days. We've all been able to be in person here in New Zealand for the ICA, the International Communication Association. And one of the things we're really looking forward to is hopefully in 2022 in Paris, we can all be in person together for the whole ICA conference. But until then, what I would do is I would encourage all of you to please take a look at the videos online, engage with the participants, respond to the panels, send your questions in, and please do participate in that way. What we have today at 11 o'clock our time in Aotearoa is intergroup processes across diverse contexts. So what I would do is I'll turn things over to Breeze, who is our tech guru, one of our two tech gurus. I have to thank Breeze and Richard for all the work they're doing on this. And he will upload or play the first video, and we'll have a few videos and then have discussion afterward. So over to Breeze for the video.
Thank you, Stephen.
The foundation for this study is really based on the idea of socialization outgroup attitudes. So we know that a great deal of intergroup scholarship has focused primarily on negative aspects of intergroup bias and ways to reduce these negative outgroup attitudes, oftentimes through intergroup contact. There's also a body of work that focuses on trying to explain why we actually might help support or demonstrate general compassion or concern for outgroups, especially related to mass suffering such as poverty or genocide. Olliner's work and McFarlane and colleagues' work has focused on notions of extensivity or inclusive worldviews to explain that we may just view outgroups as a larger aspect of humanity, and that makes us want to help. Slavic explains that one of the barriers to helping is we simply can't comprehend the large numbers of outgroup suffering when it comes to poverty or genocide. And so these are factors that may explain why we help, support, or show concern for others, or why we may not. This all fits with Rittenauer's notion that moving forward, when we talk about socialization of outgroup attitudes, we need to both look at how attitudes are initially developed, but also focus on these positive or inclusive orientations towards others rather than just the socialization of negative intergroup bias. And this also fits with Solis and Rittenauer's notion that families are a site of intergroup socialization. It's one of these places where these attitudes are initially developed. And so the purpose of this study is to understand the nature of family communication about outgroup suffering and the connection, if any, between this type of family communication and perhaps more inclusive worldviews, meaning like connection and caring. So the first research question focuses on the nature of family communication and based on the Rememberable Messages framework asks, in what ways, if at all, do families socialize younger family members about the suffering of social outgroups? The second research question gets at the second part of our purpose. Is there a relationship between the frequency of discussion about suffering of others in the family and these more inclusive worldviews? Okay. This was part of a larger study on outgroup attitudes and social justice behavior with a little over 500 participants of young adults in the United States. The survey had open-ended questions to answer research question 1. And specifically, they asked about family messages and conversations related to mass suffering in the world, such as genocides, natural disaster, war-torn areas. And we analyzed this through a reflexive thematic analysis, looking for themes that emerged and always returning back to the data in this constant comparative method. The second research question was through some scale items on the survey. We asked about frequency of discussions related to various social issues related to mass suffering. They answered the identification with all humanity scale and perceptions of social responsibility. So for instance, asking about the extent to which they feel that they should help people or communities that are less fortunate. So higher scores in both of these reflect more inclusive and pro-social behaviors. So for the first research question, we'll talk about 4 general themes. Okay? And this was asking about the memorable messages that participants recalled receiving from family members. So the first theme was really families rationalizing mass suffering. So some families talked about it, how it is God's plan, and oftentimes more blaming others for not having a faith or putting God central to their lives. Oftentimes there were messages about controllability, basically saying that you just can't control things, that people need to learn from history to not repeat mass suffering, and functional indifference. Some of these messages were just messages that the universe is random and cruel. So as you can see in this theme, there's not so much about helping others. There's more these messages about mass suffering just happens, or even putting blame on others. Okay. Then there were messages about responding through support. So for example, responding through emotional and spiritual support. So participants would recall that parents would tell them that they have to pray for people or be very spiritual in this sense and really connecting with others. Okay? Or they talk about tangible support. Okay? So participants said, when the tsunami of 2004 hit, my parents explained that many people lost their families and possessions. And this participant goes on to say that the parents and the family members actually talked about how they can help people and why they should help people. Okay? Oftentimes, participants talked about memorable messages where mass suffering is teachable moments. So if we're talking about poverty, they would talk about money as a way to understand that they are more fortunate than others. Or even something as simple about, my parents made me eat everything on my plate because this is how they taught me about people around the world having nothing to eat, and we need to understand those. So these memorable messages were teachable moments related to mass suffering. Okay. Others had narratives of mass suffering, and some of these came from media narratives. So media representations where perhaps they would watch a movie and really allow them to connect with that, where the parents would be a mediator between what is depicted in the movie and talking about suffering in the world and what they should do. So participants would discuss about watching Hotel Rwanda and learning about how the world truly turned a blind eye when the genocide occurred, and the family used that as a way to talk about this. Or oftentimes family members would talk about direct experiences of grandparents or great-grandparents and what they went through, and making sure that the younger generations are seeing the connection between their family members and in-group and what could be happening with an out-group. So these were the 4 broad themes that emerged in the types of memorable messages. And as you can see, these vary from those that are more kind of indifferent or just simply rationalizing it, to those that are more about compassion and care for others. Now, the second research question asked about if there's a relationship between the frequency of discussion about suffering of others in the family and more inclusive worldviews. Okay, so one thing we looked at is the frequency of conversations. And there were moderate levels of discussions in the family. So about a mean of 2.46 and a scale from 1 to 4 were not at all to a great deal. So that means that approximately half of participants indicating the parents and family never or rarely discussed these topics about mass suffering. So this is really important because it really frames the first research question that, yes, you get these messages, but in more than half the families, they simply do not talk about mass suffering of others. And we'll talk about the implications of that in terms of intergroup socialization here in a moment. Okay. We don't have time to go into all the statistical details, but when we looked at the relationship between the frequency of these conversations, the inclusive worldviews, and then commitment to social justice type questions, there were significant associations between the frequency of discussions and these outcomes, with correlations ranging from 0.05 to 0.21. So as you can see, some of these were significant, but not a great deal. And again, we'll talk about that here in a future research. So first, we have to realize that discussions about mass suffering are not common in families. As we've said a few times, more than 50% of families do not even talk about genocide, poverty, war-torn areas of outgroups around the world. So we have to recognize that one aspect of intergroup bias is simply the lack of attention or minimization of other, rather than just simply focus on negative biases and negative stereotypes. We have to recognize that a major and common aspect of intergroup bias is simply not talking about others, this lack of attention to others. We also need to look at these various types of memorable messages to determine how they're connected with both attitudes and actions. So if you receive the rationalizing messages versus the emotional and spiritual messages versus the types of messages in which people are using stories and narratives to make you understand the suffering of others, how are these connected with attitudes and action? And then a main focus of the study was to look at the frequency of family communication about experience of outgroups and see if that was related to inclusive and social justice oriented worldviews. There were some significant associations, but they weren't that powerful. So this doesn't mean that family communication does not affect these worldviews. After all, we were just looking at frequency of these behaviors. But what we need to start looking at, need to examine how family socialization processes intersect with other experiences such as intergroup contact, education, other aspects of our social world to create inclusive or biased worldview.
Next video.
And so we'll have our next video now.
Good morning from Wellington, everyone, and thanks for being here today. Currently, we are based in New Zealand, Russia, and the US. Our group has been doing research on prejudice in the context of COVID-19 pandemic for a year now. This piece is part of our larger project, and it was done in Brazil, India, Mexico, South Africa, and the US. As we have a short amount of time, I'll quickly go through the core concepts, method, as well as the findings of this paper. To begin with, let me briefly introduce to you the perception of threat. Stefan and Stefan developed Integrated Threat Theory, ITT, in 1990s. Since then, ITT has been used as the theoretical framework to apprehend, explain, and predict prejudice in multicultural group settings. Although the ITT model has 4 types of threat, we only focused on realistic and symbolic threats in our paper. Basically, realistic threats refer to the welfare, physical and material well-being, economic and political power of the in-group. On the other hand, symbolic threats are related to morals, values, standards, beliefs, and attitudes of the dominant cultural group. According to Stefan and Stefan, the realistic and symbolic threats do not need to be real. Only the perception of threat can cause prejudice. Speaking of the intergroup relations, ethnocentrism is one of the core concepts to understand the relations between groups. Ethnocentric individuals perceive their own group as the centrality, and usually they tend to have negative attitudes and behaviors toward other groups. Ethnocentric behaviors depend on group boundaries, including different characteristics like language, religion, accent, or physical features. We cannot deny that the COVID-19 pandemic has raised an alarm of racist incidents towards some specific groups around the world. The threat from an infectious disease might lead to disgust against people suffering from such illness. Besides, previous studies have shown a positive relationship between prejudice and ethnocentrism. Because of the above reasons, our study explores to what extent ethnocentrism can predict prejudice during the COVID-19 pandemic. We conducted our study by borrowing for existing measures from previous studies. Symbolic and realistic threats were measured by 6 items from Stefan and Stefan. A shortened version of generalized ethnocentrism scale, including 14 items, was used to measure ethnocentrism. Fear of COVID-19 was measured by 3 items adapted from Bhutan et al. In total, there were 2,420 participants in our study. Statistically, we applied Pearson product moment correlations and multiple regressions analysis. 2 multiple regression models were constructed using symbolic and realistic threats as the criterion variables. In these models, ethnocentrism, fear of COVID-19, and nation served as predictor variables. A dummy variable was created for nation with the US serving as the reference group. Cross-product terms in hierarchical regression analysis were generated to test for interaction effects. And before testing for interaction effects, all variables were mean-centered. The statistical analysis showed us 4 main results: a positive relationship between ethnocentrism and realistic threat, a positive relationship between ethnocentrism and symbolic threat, interaction effects between ethnocentrism, nation, fear of COVID-19, and realistic threat, interaction effects between ethnocentrism, nation, fear of COVID-19, and symbolic threat. In general, our study has 3 crucial findings. First, ethnocentrism is positively related to realistic and symbolic threats among dominant group members toward outgroup individuals. In this case, the outgroup individuals are Asians in Brazil, Muslims in India, Americans in Mexico, foreigners in South Africa, Asians in Spain, and Asians in the US. Second, nation-state had a significant man and interaction effect on symbolic and realistic threat. Third, fear of being infected by COVID-19 influences the relationship between ethnocentrism and realistic threat, and ethnocentrism and symbolic threat. To sum up, I'd like to show you the implications of our study. Firstly, an understanding of the relationship between ethnocentrism and integrated threat during the COVID-19 pandemic is critical to the development and refinement of integrated threat theory. Moreover, our paper has implied that a contagion can become a potential new target outgroup. Finally, the results of our study reveal the complexity and messiness of intergroup communication, especially in such global health crisis context. Well, we've been through an overview of our research. Thank you for joining us. If you have any comments or feedback, please keep in touch and have a nice day, everyone.
Thank you. And we'll have our final video, please.
Hello, my name is Matt Giles. I'm a communication PhD candidate at University of California, Santa Barbara. I've been working with Howie Giles and Rachel Pines for the past few years on a communication model of intergroup interdependence. And so today I'm going to be actually talking through intergroup interdependency theory and some of the different applications of that we've done previously and kind of where like recent studies have taken us and what's happening next. So intergroup interdependence is this notion people have of their like awareness that the way that you are connected to another person or group is going to change your communication with or about them. Just being aware of that connectedness actually is, a motivating factor in people's community activities. And so our reason why we started thinking about intergroup interdependence was really this call to arms from Don Taylor and colleagues, where he said that we have argued for the need to expand the theoretical base of intergroup communication, not as a replacement for social identity, but to broaden the field. And so we really like this idea of looking beyond just social identity to kind of look at how do intergroup relationships affect other intergroup relationships. And so what we propose is that the more that someone is aware and is processing their valued interdependence, they're going to have a better relationship with those valued groups. Likewise, the more you're aware of your interdependence and like stuck connectedness with a conflictual group, then the more conflict you're going to feel. These effects are going to be accentuated or attenuated under a variety of different circumstances, which we go through in that theoretical piece, which you can see in the 2018 Giles, Pines, and Giles. So what this really does and what we're using this theory to do is to really put some context around interdependent or intergroup relationships. It's so easy to commonly think of intergroup relationships as being, group A and group B, the blue group and the red group, and maybe like this kind of purple people that are in the middle of this, but it's really not that. What we end up finding so often is that there's so many other intergroup contexts that are affecting our relationships and our interactions that's never really a blue and red interaction. It's more like a purple and orange interaction. There's always more connections that are happening that are affecting our relationships. This is something that we saw when we did the first empirical test of intergroup interdependence theory, where we were looking at Canada-US relationships. At this point in time, when we were doing this in 2018, the US was having a fairly rough, rocky relationship with Canada, where there'd been issues about the US leaving some trade agreements and things like that. So we thought it would be a good time to bring it up for other people. And when they were reading these prompts, what they ended up seeing was 2 pages from a textbook where it was supposed to be an 8th grade history book in 2018 for the new one, and then an older version of 2008. And they were just looking at and kind of reading through the changes that had happened from 2008 to 2018. And so they read doctored versions of that, where they're reading either their relationship is getting better and better, their relationship is kind of sticking out how it is, or the relationship is getting much worse. And so as they read that, they were then responding to questions about their attributions of Canadians, their level of accommodation towards them speaking, and a whole bunch of other things like that. What we found is that we were able to produce a higher sense of connection for our participants, but really their ways of communicating weren't changing based off of what we had done. And what I think was happening here is that it's pretty hard to change someone's behavior about a group they already have a crystallized perspective of. And so if you already have that level of solid understanding, then just reading something isn't going to change that. It may make it more salient to you. But what was so interesting about this was that even for people that read the negative ideas, that read about the relationship getting worse and worse and worse, that's represented by the gray line here, the D interdepending. Even when they got that, you can see the slope on that line is so positive. Simply having read this thing and then responding to questions after it, people felt more connected. And so we were so interested in this idea that, wait a second, connection goes up even when they're de-interdepending, the sense of connection. So wanted to go through and really look at what are the barrier conditions that make it so that intergroup interdependence is more or less likely to happen. And so this last thing that happened on the findings, that reading anything can trigger that sense of interdependence, because what I think is happening is even when somebody is reading something that is saying something negative about another group, all of a sudden that's new information that they're having to process, and they're deciding in their head, oh, this is what our connection is with them. I feel more connected with them just because I know this. I know there's a change, there's something salient here happening. So what we wanted to do a new study looking at is, what are the conditions under which someone's going to actually change their communication? And is it something that there's certain types of communicative activities are going to be affected more by it? So for this study, went through, and here's the hypothesis that I set up for this general idea that participants are made aware of changes in their interdependence with an unknown group. An unknown group, mind you, they'll experience a corresponding change in their sense of connection, their positive attributions for them, their accommodation towards them. And I'm really hoping from the study that we were able to see that their communicative behavior is going to actually affect how they interact with other people as well outside of those groups. So like that previous study, people read a fairly involved vignette that was actually a briefing that was showing the relationship between two countries, the United States and an anonymized, redacted country. And so you can see that up on screen in red there, where people were reading this and they had this imaginary group that we could manipulate however we wanted to. And so what we found was that by telling people that this group was either more or less, connected to them as U.S. citizens, that was actually going to affect their relationship with this new outgroup. Because after they did that, I actually had them read a really short news story. It was about Asian American linguistic issues that are happening, such as the labeling of the COVID-19 virus and other things like that, that have actually affected the way that communication about Asian Americans has affected Asian Americans. So I wanted to have them read something about that. And then after doing that, take this the same battery of questions where they're looking at their accommodation and attributions, other things like that, and compare their anonymized perception of, well, this is my perception towards the other that I don't know, and see if that actually carried on and affected their perception of Asian Americans. And what we found actually is, yes, we were able to increase attributions, accommodation, and everything for each one of these groups. But most interestingly is that it did cross groups. You can see here that, I know it's like a whole mess of lines, but in that situation where it was the out group decreasing the relationship, that led to decreased attributions for Asian Americans. But when they were reading about something where the relationship was increasing, then you can see a dramatic change. And so this held true throughout all the studies, that you would see this increasing high slope and this really negative or just low slope for when the out group was changing things. As we did this study, something that comes to mind again and again is that I need to not just be coming up with things that are theoretically interesting, but we need to really be able to find things that we can do interesting work with in these studies. And so I would be thrilled to hear from anyone about, intergroup relationships that they're studying and how we could find ways to kind of investigate what other relationships are having an effect there. I appreciate everyone's time. Have a good one.
Okay, well, thank you. We have our 3 papers. Now, as I said, I would encourage everyone to reach out and ask any questions. What I would do is I will just start things off very briefly here. There's a lot of similarities across the papers, but also a lot of difference, which is nice. I think it's one of the nice things about intergroup communication. Someone who does organizational and intergroup and also has a paper on this panel. It's really nice to see the diversity when it comes to where research is taking place, that it's not Amerocentric. And so we see research in different areas. We also see different research methodologies, even though they're largely quantitative, still different quantitative approaches being used. Also different connections to other fields, which we see connections to research in psychological research connected to health. We see more theoretical work. And so we see quite a bit of connections, which shows really the depth of intergroup communication, where it isn't just looking at in-group, out-group, and racism anymore. There's a lot more connections to other areas. So those are a few of the things I found are really interesting. But what I'd like to do is really ask anyone here in this room if there are any questions that they have for the panelists. And if there is a question you have for someone who wasn't here, so basically, if you have any questions for Thao, let me just say that since Thao is in the room, if you have any questions for Thao or myself, ask us. If you have any questions for other 2 panelists, if you could just maybe post that to their page or post that to their speech, that'd be great. Or if you have any comments on them, we can say the comments here. But if you have specific questions, it'd be good to go to the ICA website and actually put those on their speech, on their presentation, so that they can see it there. Do you have any questions for Thao or myself? And Doug Ashwell was also on the paper. So we have 3 of us who were on the paper. So
I have a question to Thao. That is, your paper is prejudice toward other during COVID-19. So we know that fear of getting COVID-19 is common for all people. So what's maybe the difference between the general people and the other means the marginalized group? So is there any difference for fear getting COVID-19 fear? What is the difference between normal people or other people, that is marginalized group? What do you think?
Thank you for your question. And like the COVID-19 has affected all around the world right now, and the people who are suffering from the racism the most is the Asian ethnic group. It's quite different in countries. For example, in the US, so the Asian Americans are the target group, but in Mexico, for example, like they blame the American tourists. So that's why we've been doing research on a larger scale of the study. Like we've been collecting data for almost over 20 countries right now, and the data turns out to be really, really interesting, and we need more work about it.
I may follow up. I would say it's also interesting that generally the past few days we've talked about how we define marginalized, but I think it's also very different now with COVID-19, because if you look, Thao mentioned Mexico is there. The media and even the politicians have blamed American tourists who come down for spring break.
Yeah.
And so there, while many people would say, well, Americans cannot be discriminated against, cannot experience racism, or especially white Americans. In this case, when it comes to how they've been depicted in the Mexican media, how they've been depicted by some Mexican government leaders, especially regional leaders and others, they may not experience racism because of the power dynamic by definition, but it's just another word for what they're experiencing.
Yeah.
And how they're being depicted. In Brazil, it's not just Asians, it's also Afro-Brazilians or Petos. You see the same thing if you look to Kazakhstan and Kyrgyzstan. It's basically they're migrant workers. And so it's not always who we would generally think as the margin or the fringe or those group. Often it's like in South Africa, it's the wealthy South Africans who have largely been blamed because they went away and came back. And so it's really, in many cases, the privileged are now being blamed in some places. And so it's really been interesting when it comes to who becomes the out group in this case. It's who can we blame for it? And even here in New Zealand, we've been blaming Asians in some cases, but also our next biggest group we blame are tourists.
Yeah.
People who cross our wall, which is the Pacific, and our MIQs are also who we blame. So the idea of marginalization, I would say almost with COVID-19, I would say our models of marginalization, our models of hegemony, our models of racism, we almost need to throw them out because they're almost irrelevant in this case. Because I would argue that anyone, no matter what your race, no matter what your color, can experience COVID racism.
Yeah.
So I would say.
So I would like to ask, like the ethnic minorities in New Zealand are often classified as the other, and the dominant group is always the normal. So, but in case of New Zealand's pandemic communication, it is touted as the exemplar model, where it was, the notion of kindness and care and a team of 5 billion.
Mm-hmm.
So how do you relate to this prejudice towards others? And there is a model of kindness and a team of 5 billion. Yeah.
Well, I think when it comes to relating to it, what we looked at in New Zealand, Thao was part of this.
Mm-hmm.
We had one paper we've had a couple of papers on this. We were looking at really when we surveyed individuals, we particularly looked for, in New Zealand, Pākehā was who we surveyed. Pākehā, that was it.
Yeah.
Because we're looking at, they are traditionally the dominant economic, political, cultural group.
Yeah.
And we looked at who do they prejudice? Who do they identify? And the questions we're actually looking at, the first survey we did, we've now done 2 data collections in New Zealand. The first one was looking at Asians, particularly Chinese. We use Chinese because that was the word more used here. And so we were gearing it toward that specifically. We were choosing the out group. But then we've done another follow-up study, which was more qualitative, looking at who do they blame, which is now under revise and resubmit, that'd be the third one, which has found it's not only Chinese, but also tourists and others. The government is partially blamed as well for not closing the border soon enough. And so really we're letting them, the participants, in some cases we define who the outgroup is based on the media framing and the political framing. But in other cases now, especially we've learned after the first round of data collection, The second round, we're going through and having open-ended questions, asking who do you blame? And that's where we're finding some of these interesting results.
Yeah.
But you generally go with what the media and how they're framing the blamed group. And here, I mean, yeah, 5 million come together, but even then, it's still a matter of how long can that hold? Because while the government might say we are 5 million, there's still comments by government officials and politicians and media folks about who we want to blame. We still say that as a government. So, yeah. But it's interesting to look at all the differences throughout the world and really how this contagion, which, you know, Thao mentioned, has really changed how we look at things. And I would say that throws up all of the paradigms we have on what is racism and discrimination. One of the things I would argue, and I'll finish with this and I'll quit talking, is I would argue probably in the next few years, all of these policies we have now about immigration, when it comes to say, if I were say to move to another country and try to get a job, my argument is probably in a few years, there's gonna be a lot more health related laws about have you received this vaccination, this vaccination. And some would say that's discrimination, but others would say it's racism because it is a power issue as well. And so we have to really, I would say we need to really look at how do we define racism and discrimination now in a post-COVID world, because now it's going to be health racism. And some would say health discrimination, but still there's a power dynamic. So it's really health racism now, or COVID racism, vaccination racism, and things like this, which I know is your area with vaccine hesitancy. But how is vaccine hesitancy going to translate into vaccine racism, vaccine discrimination, and vaccine segregation and ghettoization?
Vaccine availability.
Yeah, and that's the thing. If people don't have availability, they're automatically put into like vaccine, you know, ghettos possibly in the future, which we see with some of these refugee camps. They're basically vaccine ghettos. And I hate you. That's by definition what the word is, and so it's creating more of a problem, which is really scary.
Just one question.
Yeah, please.
So in your study, did you have like stakeholders as your participants, like working in government organizations?
No, they were through politics. One of the things we were focusing on is not trying to focus on how stakeholders or certain kind of groups feel. Focusing more on just working with, say, like a group like Qualtrics or MTurk is really just looking at generalized how the general population feels. That would be a very different kind of approach, looking at the stakeholders, which I would leave to probably someone else to do. In this case. It's not the kind of work that we would really focus on. I think in each of the countries we're working in, many of them we could work with Qualtrics to get a large enough sample to really generalize, by using that in quotation marks, generalize to the average, whatever the dominant group is. We could generalize to a point. Even in India, we worked with India. We looked at the Mohan Dutta helped with that survey setup. There we surveyed Hindus only. But there we realized a population of 1,000, we still can't. Technically, you can generalize off that statistically, but still it's questionable. But I think that that's the key thing, is we're focusing on just generalizing. So, well, if there's no other thoughts, what I'll encourage everyone to do again is please send any thoughts you have. I really enjoyed the other two papers. I think it's great to see theorizing, like in the Giles paper, and in the first paper, it's really cool to see that kind of statistical analysis as well. So, I mean, they're really kind of papers that, you know, appeal to me. I like seeing the stats. So I also like, in the past few days, I've seen lots of really interesting critical cultural work, which has been really good to see. I'm happy also to see some stats as well. So I really enjoy that. One thing I would encourage the two to do, particularly the first researcher, is when you're looking at the correlations, one thing I always do as a panelist is when you're looking at the correlations, yes, a 0.05 to 0.21 those are low correlations, but look at your sample size. You have over 500 participants. So basically with over 500 participants, almost anything is going to be significant. So you could almost say bananas are correlated with the table with that sample size. So I think maybe look at the practical significance when it comes to the sample size. It's one of the things we had to be very careful about in each of our countries, where we had like 500, 600 people in many of the countries, is the sample size it's strongly linked with Pearson's correlation. So take a look at that. That's one of the things you might want to talk about in the discussion if you haven't had the paper published yet. And even in the methods section and results is really, it's one way to address that and at least acknowledge that. with that, I think that's really it for us. We still have a few more discussions today. We have a couple more. I think we have one more at 2 o'clock, maybe. It might be wrong on time. 1:30. Thank you, Breeze. 1:30. Thank you, Breeze. I'm gonna move everybody, keeping me on track. At 1:30, and then we have the closing at 3 as well. So we hope to see you then. And those are New Zealand times, folks. Sorry, I'm stuck on New Zealand times. I live here. So all the best. Stay safe, and we hope to see you soon. Cheers.